Good morning, Chairman. We're ready to begin.
Good morning, Denisha. If you conduct the roll call, please.
Yes, I'll begin with Roger Folsom,
Here.
Tommy Hopkins. Tommy Hopkins. Norman Boyd,
Here.
David Cruz,
Here.
Anthony Williamson,
Here.
Shane Mobley,
Here.
Robert Coles,
Here.
Kathleen Ruth,
Here.
Cynthia Rucker. And I'll ask again, Tommy Hopkins. That concludes my roll call, Chairman.
Okay, it appears we have a quorum, so we will call the meeting to order. Good morning, everyone. The Masters officially got underway this morning, and it's spring break for many, and we appreciate your time being part of the board meeting this morning. I didn't hear Dr. Hopkins answer the roll call, but the minutes for March 13th have been reviewed, and I would make a recommendation we approve those if that would serve the purpose, Denisha.
Yes, Chairman.
Entertain a second for approval of the minutes.
Second, Dr. Coles.
Dr. Coles has seconded. Any further discussion or corrections or additions? Hearing none, all those in favor by aye.
Aye. Aye.
Any opposed, no. Minutes are approved. Thank you. We have a rather brief agenda this morning. We have two items to consider for final adoption, which we'll move into shortly. And we also have Commissioner Russell Carlson absent today. He is on spring break with his family, as many people are enjoying spring break, and we appreciate our Chief Operating Officer, Joe Hood, being with us this morning for that portion of our agenda. But before we get to that, the Care Management Committee met this morning, and I would call on Chairman Anthony Williamson for a report on that meeting. Anthony.
Thank you, Mr. Chairman. We did meet this morning, and I want to thank Stuart Portman for pulling our agenda together this morning. We had a report from Brian Dowd, our Deputy Executive Director, and also Michael Smith, Director of Medical Assistance Plans from Behavioral and Member Services. And it was focused on the care and treatment of individuals who are on the autism spectrum or autism spectrum disorder, or ASD, as we referred to it during the presentation. Brian shared that this is one of the larger or fastest areas of growth underneath our Medicaid spending. And he also shared a little bit of history about the treatment of autism spectrum disorder in terms of the coverage under the state of Georgia. It really kind of began in a more formal way in 2018. It was pushed by Governor Deal, and as we understand it, Sandra Deal was a big advocate for it. Certainly her lifelong pursuit of being an educator and working with children, I'm sure, had something to do with that. But it was a multi-agency approach involving not only DCH, but DPH and DBH, DD. There's a focus on behavioral therapy and the various providers of this therapy were discussed, including what are known as BCBAs, or Board Certified Behavioral Analysts. There's different levels of those depending on degree of education, as well as registered behavior technicians that play a role in this. Of course, as it was rolling out, a lot of the work that Brian covered, had to kind of be foundational in terms of rolling out the procedure codes and learning how to focus on early intervention. There were not a lot of BCBAs in Georgia at the time of 2018, and we were fortunate that we did have an influx from Florida and South Carolina for various reasons of things happening in those states. So there was a implementation of a tiered rate approach for the various levels of providers who care for patients on the autism spectrum, including telemedicine coverage. These services are provided in homes, clinics, schools. A prior authorization is required, which will stipulate the number of hours of treatment that these individuals can receive. And a lot of the treatment focuses on adaptive behavior, improving social skills, working in groups, exposure to various things, learning better language and communication skills, essentially kind of improving overall functioning, self-care, motor skills. Some of those things were covered by Michael under the area of applied behavioral analysis. He also stressed a key tool of behavioral analysis is positive reinforcement. That is something that is heavily emphasized. And we kind of wrapped up the session with some comments from Brian on the overall status of providers in the state now. And as you might expect, there still is an ongoing need for more providers and assessors of children who may have autism, mostly, as you would expect, in the non-metro areas is where we see those supply deficiencies. It was a very good educational session and very timely, and that was the core of our meeting this morning. So I will stop there.
Thank you for that report, Anthony. Does anyone have any questions for Anthony regarding the committee meeting this morning? Well, again, thank you and the committee for meeting this morning and that good report. We'll move into the commissioner's report. And Joe, again, we're glad to have you with us this morning. And Joe is our Chief Operating Officer and is filling in for the commissioner this morning, as he, I know, can competently do. So, Joe.
Thank you, Mr. Chairman. The commissioner sends his regards. As you're aware, and as the chairman spoke to, the legislative session has ended. The Masters has begun. That is traditionally the time frame of when that occurs each year. And with the ending of the legislative session, the commissioner wanted me to remind everyone of what that means for us. And the governor's office begins at this point in time a bill review process, which includes the budget. And he and his office have up to 40 days to review all the legislative bills and the budget, and before he makes signature on each one of those. And as you might imagine, that'll be an iterative process. So they'll review some bills and do some bill signings and move through that process. But we'll be in a wait and see mode until that process is complete. And at its conclusion, particularly in the budgetary arena where we have rate increases for various providers and or legislation that impacts the department directly, we'll be bringing that back to the board as appropriate and applicable. But it'll probably be, it may not be next month, it may be the following month, or it may be a combination of those. But that's the biggest piece of that is we've had a number of items that came through the legislature. Particularly, we had our 2 department bills, which we were sponsored, and those have been successful and upon signature will be implemented. One was the movement of state licensure programs to DBHDD, a number of those, and we've talked about that previously, and that's in the budget and the bill. So we're excited to have a successful year and to be moving forward, and we'll wait for the governor's office to conclude with each of those processes as it moves forward. The second item that I wanted to bring forward was something that the board has approved recently. It's the PACE program, or Program of All-Inclusive Care. We have spent a a good amount of time at the department building the PACE program and preparing to release it. And I'm proud to say that we have released that request for proposal. And we're going to have a bidders conference at 1 o'clock tomorrow, Friday, in this very room for all interested parties. The request for proposal is announced on the Department of Administrative Services website, as are most procurements, and it has all the documents and the procedures there for question and answers and inquiries. And as we proceed through, it will have additional information posted there. But we're excited to move through that in the next 30 to 45 days and have folks apply. We'll have up to 13 different locations within the RFP that potentially could be there. And just very excited to bring that program to Georgia and to see the interest that may be there. The last thing that the commissioners asked me to do is to do our traditional review and recognition of folks' milestones and tenure in the department. And I'm happy to do that now. So first, we wanted to recognize our long-tenured 25-year employees, and we have two. One is Carolyn Diane Yawn in the Board of Dentistry and Pharmacy with 25 years. Congratulations, that's quite an achievement. And then the second for 25 years is Nicole Thompson with the Healthcare Facility Regulation Division. Next, with 20 years, we have two, Marilyn Ellis with the Medicaid Medical Assistance Plan Division, and Tina Hawkins with the Office of Information Technology. With 15 years of service, we have Juanita Hines with the Medical Assistant Division, or Medicaid, and Rebecca Duggard with Medicaid with 15 years. With 10 years of service, we have Eileen Ward with the Division of Financial Management. And then with 5 years of service, we have several. We have Jean Levi with the Healthcare Facility Regulation Division, Mula Xavier with the Medicare Assistance Plans Division, Treasurer Harewood with the State Health Benefit Plan Division, and with the State Office of Rural Health, Amanda Sutton. And then with 1 year of service, we want to recognize Kofi Lacefield with the Office of Information Technology, Melanie Brooker with the Healthcare Facility Regulation Division, and Adele Rogers with the Healthcare Facility Regulation Division. Congratulations on 1 year. We're happy to have each of you here as well and look forward to your continued service. Lastly, I wanted to do one additional recognition, Mr. Chairman. Our longstanding Human Resources Director, Kelly Washington, she's not here with us today. As is normal, she's out doing a job fair, I believe, off-site. But unfortunately for us, she is leaving for a greater opportunity at the Georgia Department of Transportation. And her upcoming departure from the Department of Community Health will be at the end of this pay period. And she's been with us for over 10 years here at the department, and I believe over 25 years within the state of Georgia. And we just want to wish her well and recognize her service. She's been a great HR director, and the commissioner wanted me to make sure that we gave regards there and made sure that everyone knew of her departure and, of course, knew of how we hold her in high regard and look forward to her endeavors at DOT. But in that same venue, we wanted to welcome Jocelyn Minor. Jocelyn is going to be our new HR director. She was a deputy underneath Kelly, and we look forward to working with Jocelyn. Are very happy that she's agreed to step up into this role, and we know she'll do a great job, and we'll have continued service there, and just look forward to that. And with those remarks, Mr. Chairman, that concludes the commissioner's report.
Thank you very much, Joe. Does anyone have any questions for him? We certainly want to extend our congratulations to those employee milestones that you highlighted for us. Thank you. We will now move into our working agenda. First item for final adoption is rules and regulations for personal care homes, and Melanie Simon, General Counsel, will present to us. Good morning, Melanie.
Good morning, Mr. Chairman, Mr. Hood, and members of the board. The Division of Healthcare Facility Regulation presents rules today for final adoption for personal care homes. These rules are found in Chapter 111-862 of the Department's Rules and Regulations. The revised rules establish an exemption for certain medical foster homes, address requirements for medical alert systems, clarify staffing levels, and provide for portable memory care training. An opportunity for public comment was held on March 4th at 11:30 a.m. via Zoom, and written comments were due on or before March 7th, 2025. We did receive an oral comment from Katie Ramp, the President and CEO of the Georgia Senior Living Association, and we received written comments also from Katie Ramp and from Nancy Pitra, who is the Director of Government Affairs for the Georgia chapter of the Alzheimer's Association. The commenters expressed support of the proposed changes, noting that the adoption of medical alert devices and technologies will enhance the quality of care for residents, and the changes will support affordability and accessibility of personal care home services by allowing flexibility in how homes deploy staff. They also noted that the updates in dementia care training will make it easier to hire, train, and support the workers needed to provide care in those settings. The department appreciates the comments and the support of these proposed changes, and we are requesting consideration today for final adoption of these rules, and I'm happy to answer any questions.
Are there any questions for Melanie from the board? Hearing none, is there a motion for final adoption?
Kathleen Ruth, motion to move for final adoption.
Dr. Ruth has moved for final adoption. Is there a second?
Second, David Cruz.
David Cruz has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion by aye.
Aye.
All those opposed signify by no. Anyone abstaining? Motion carries. We will now move into the second item that Melanie will also be presenting to us, rules and regulations for assisted living communities. Melanie, proceed.
Thank you. These rules are also presented on behalf of the Healthcare Facility Regulation Division, and the rules and regulations for assisted living communities are found in Chapter 111-863 of the Department's Rules and Regulations. These revised rules are similar to those for personal care homes. They address requirements for medical alert systems, clarify staffing levels, and provide for portable memory care training. An opportunity for public comment was held on March 4th at 1 p.m. via Zoom, and written comments on these proposed rules were due on or before March 7th, 2025. We did receive 3 oral comments from Seth Daniels, the Director of Government Affairs for the Georgia Senior Living Association, Melanie McNeil, the State Long-Term Care Ombudsman, and Donna Moore. We also received written comments from Katie Ramp, President and CEO of the Georgia Senior Living Association, Melanie McNeil, the Ombudsman, and Nancy Pitra, the Director of Government Affairs for the Georgia chapter of the Alzheimer's Association. 3 commenters expressed full support of the proposed changes, noting that the adoption of medical alert devices and technologies will enhance the quality of care for residents, and that the amendments support affordability and accessibility of personal care home services by allowing flexibility in how homes deploy staff. They also noted that the updates in dementia care training will make it easier to onboard staff to provide care in assisted living communities. One commenter expressed concern that the rules do not require a staff person to be present at all times to monitor the stationary location that is used as part of the medical alert system, and that there is no requirement for a tracking feature that could be used to locate missing residents. 2 commenters questioned the use of the term wearable in reference to the medical alert device, suggesting that some residents may prefer to carry a device rather than wear it. I would like to provide some response to these comments. The department is very appreciative of the support received for these rule changes. Regarding the specific comments on the medical alert system, the department adhered to the parameters of House Bill 1335 from the 2024 session of the Georgia General Assembly in drafting these rules. House Bill 1335 specifies that the medical alert system must include a wearable device for the residents. Additionally, the legislation does not require any particular type of tracking technology. The department recognizes that these medical alert systems will provide an additional layer of communication for residents in assisted living communities. However, the assisted living community remains responsible for meeting the needs of residents regardless of the tools and systems being used. As such, the proposed rules provide general requirements for medical alert systems, but do not mandate particular features of functionality, as those decisions are best made by the facility that is ultimately responsible for providing safe, quality, and timely care to residents. Similarly, the rules require that the stationary location that is used as part of the medical alert system be monitored by staff, but do not specify that staff must remain at the station at all times. The focus of the department's oversight is on whether or not the needs of the resident are being met. The facility must manage both staffing and must utilize the medical alert system in an effective manner in order to address all resident needs. I'm happy to answer any questions, and we are requesting consideration for final adoption today.
Any board members have questions for Melanie regarding this item? Hearing none, is there a motion for final adoption?
Shane Mobley motion.
Mr. Mobley has made a motion for final adoption. Is there a second?
Second, Williamson.
Anthony Williamson has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 All opposed, no. Anyone sustained? Motion carries. Sounded like to be unanimously. Melanie, thank you for presenting both those items this morning, and they're both have been approved for final adoption, so good job.
Thank you.
Is there any new business that needs to come before the board this morning? Anyone know of? Well, if not, again, thank you for your time this morning. Enjoy the rest of this spring day and maybe a little Masters later in the afternoon. Joe, we appreciate you being with us and presenting in Commissioner's stead this morning. Melanie, we appreciate you presenting to us. And Denisha, we always appreciate all the things you do for this board. And thank everyone for your time this morning. And if no other business, we stand adjourned. Our next meeting will be in May 8th. So we'll see you then. Thank you. Have a good day, everyone.
Thanks, Mr. Chairman.
Thank you so much.
you.
Bye-bye.
Thank you.